also kind of like trying to get there with what we promise ourselves as healthcare providers with a Hippocratical oath of defending the people we're serving and defending the communities we serve. And we still feel that today healthcare providers, not only like doctors but also like nurses or midwives, but especially kind of like compound in a public health system, present in many times a barrier to access sexual and reproductive health. And kind of like that sensibilization or sensitization of healthcare providers is also important because we sometimes like replicate the same stigma and discrimination that we carry on within society. And I can't like identify within our federation like many reasons for that, but specifically because we are not taught about SRH. We're not taught how to address people. We have people to tell us what to do, or to tell us how they feel, or to tell us what it is important for us to address when we are in a doctor's office. We do not know how to do like a physical examination for a disabled person. We do not know how to examine, for example, women's health outside OBGYN. Therefore, it is something that not general practitioners will do. It's something that's specialized. It's something that is very specific and not for everyone. So the accessibility of information and that research that we are doing is also important for medical students in order to generate a new like era of healthcare providers that are comprehensive and that are attending the real needs of the population. We need to be involved within the population. And so I think like we call kind of like for a question on how can like we manage to do that. IFMSA has worked closely with institutions such as IPAS and also the IPPF in order to provide training and provide information, but we believe that sensitization of this information is also very important in healthcare providers because we want to be abortion providers, we want to be modern contraceptive providers because it is our will. We will that through a Hippocratical oath, and we're not somehow accomplishing that. And also, what is kind of like the legal protection that we have over healthcare providers that are willing to do provide these services could also like benefit in order to attend those needs. So I wanted to ask more or less kind of like what is that relationship? How can we like cooperate better together? And what has been your experience with medical education and training? Thank you.